South Africa and India called for the suspension for a limited time to intellectual property protection for patents related to the treatment of COVID-19. The move has been widely supported by developing countries that fear they will bear the brunt of the pandemic. Well, earlier we spoke to Dr. Ngoy Nsenga, the COVID-19 incident manager for the WHO Regional Office for Africa, on the implications of the decision for the continent.
We have to recognize that Africa has done tremendous progress in terms of fighting outbreak. You might recall that some years back, the most memorable example is the Ebola in West Africa, how we struggled. The outbreak went for years, actually. But lately, you could have noticed that the Ebola outbreak that we have had in our region, even though they are still in terms of magnitude big outbreak, but at least Africa or African countries managed to contain those outbreaks in relatively short time. You have noticed as well that one of the challenges that Africa has had during COVID is this overly dependence from outside in importing most of the supply, especially at the beginning. At least now, some African countries again made some progress, but still Africa is still overly dependent from outside. And more so for specialized supply, including vaccine and medicine. So there is no other way. That's why I will keep saying this, and that when in all discussion with your colleagues, there is no other way than Africa to become resilient. For Africa to build resilient health system, we need to build our own manufacturing capacity, including not only in terms of medicine and vaccine, but also including in terms of diagnosis. We need to manufacture our own tests so that we can expand the testing capacity to detect as soon as possible the cases and manage those cases in timely manner.